Please be seated. Okay, cross-examination on behalf of the state.
Yes, Your Honor. Dr. Orlando, good morning.
Good morning.
Let me cover with you to start with a little bit about the defendant's educational history. These are some of the records he reviewed, both his Georgia school records as well as his Brevard County school records, correct?
Correct.
And he did graduate from O'Galley High School 2007, correct?
Correct.
He had a GPA, state GPA at 2.6, a district GPA at 2.7.
At what time? At graduation?
Yes.
Just referring to my notes. Yes.
And in fact, his high school GPA, grade by grade, from 9th to 10th to 11th up to 12th, kept increasing every year, correct?
I don't recall.
Is it in your notes, the 2.4 in 9th grade, 2.59 in 10th, 2.63 GPA in 11th grade?
Yes, I'm reviewing my records. On my report, I stated that.
So he was increasing, and obviously it ended up at 2.6. His 12th grade GPA was the highest.
If it's rounded off, it's pretty comparable. His 11th grade was 2.63.
Now, he was 17 when he graduated, correct?
I believe so.
Which would lead one to believe that he never had to repeat any grade.
Correct. He didn't report repeating a grade.
Okay. And 2.6 state GPA, 2.7 district GPA, that is a C plus average, correct?
It's a C average. It's an average grade.
Correct. C is a 2.
Correct.
A B is a 3.
Correct.
And an A is a 4.
Correct.
Right. A D would be a 1.
Correct.
And an F is a 0.
Correct.
And the school records didn't indicate he was ever, that he ever received any special educational services, correct?
Correct.
He was never flagged for as requiring any additional educational support, correct?
Correct.
And those are things you would expect to see in the records if that were the case, correct?
In most cases, yes.
And there's nothing that you reviewed to indicate that he ever received any special educational services?
Correct.
And you acknowledge you reviewed the Department of Correction records, correct?
Correct.
You talked about earlier he received an IQ of 96 when they did their IQ test, correct?
Yes, on the screening instrument.
And that would be consistent with his high school performance, right?
Yes.
96 is the average range, right?
Correct.
And his high school performance, average range.
Correct.
Now, did you ever give the defendant what's known as the SIRS, S-I-R-S test?
No, I did not.
Okay. And how about the TOM, the T-O-M-M?
No, that's not. I did not administer that malingering test.
Okay. And you talked about the importance of, in coming to your conclusion, about the accuracy of the information the defendant gives you, correct?
Correct.
And if he gives you bad information, that would lead to a bad opinion, correct?
Yes.
So the reliability of his information is key and crucial to the reliability of your opinion.
Of course.
And you indicated that he told you he had 3 instances where he suffered head injuries.
Yes, that where his head was hit and a loss of consciousness on at least one.
One of those he claimed when he was at the age of 15.
Let me review my records. Yes.
And that's when he claimed he fell off the monkey bars, landed on his head, and lost consciousness.
Yes.
Now, when somebody tells you they had a situation like that, would it be normal to try to look for confirmation of that?
It would be normal to look for information to support the possibility of a head injury.
you would try to look for corroboration of the fact that he suffered that incident at the age of 15, right?
If he reported that he went to a hospital, yes. But there are many cases in which people fall and lose consciousness that they don't go to the hospital. So I wait to obtain a totality of information before I provide an opinion.
Okay. So he told you he fell off monkey bars, landed on his head, lost consciousness, correct?
Yes.
And there are no corroboration of that through any medical records, school records, or any records at all?
No, I did not get any medical records related to that specific event.
Now, he also indicated to you at the age of 19 in juvenile camp, he was hit on the head with a lock that was slung by another participant.
Yes.
And for that instance, any corroboration through any medical records?
No.
Through any Department of Correction records?
No.
Any corroboration through Department of Correction medical records at all?
No.
So both of those instances, you have zero corroboration independently from the defendant.
Other than his presentation and testing was consistent, and his presentation on cognitive imaging were consistent with the presence of a head injury.
Now let's go to the one instance where there's actual medical records, and that was the car crash he indicated occurring at the age of 17.
Yes.
Now, in your interview, he told you he was a passenger.
Yes.
He was not wearing his seatbelt.
I have to look at that, but he was a passenger. Yes.
That the other car did a U-turn, he T-boned the car at 60 miles an hour.
He didn't, the car
Well,
was...
the car T-boned.
Right.
He indicated to you that he hit his head on the windshield and he lost consciousness.
Yes.
You've had a chance to review the medical records, correct?
Yes.
And those are the records from Wusthof Hospital.
Yes.
And he appeared for treatment 2 days after the crash.
Correct.
And when he appeared for treatment, he indicated he was suffering neck, back, and knee pain.
Correct.
And that he had a cut over his left eye.
Yes.
And didn't he tell them that he said the cut was from hitting the airbag?
Yes.
He said he told them he was dazed, but he never lost any consciousness.
No, he said there was a possible loss of consciousness.
Did he tell him he was only dazed?
If I can, I can get the actual records out.
It's on page 2 of your report.
Right on my report, but this is the medical records. I was checking on the medical records, and it says here on page 1 that possible loss of consciousness per witness at time of accident.
He didn't report that. That was per another witness, correct? He said he was dazed.
My understanding is he reported that. That's what it suggests in the medical records, that it was a possible loss. Based upon his description, this was reported by the medical person who was recording these records.
He also indicated he was wearing a seatbelt, correct? To the hospital?
Yes, a restrained passenger with a...
Which again is contrary. He told you he was not wearing a seatbelt.
Yes.
They diagnosed him with a neck sprain, knee sprain.
Yes.
They released him with a muscle relaxer. They gave him a muscle relaxer and anti-inflammatory,
Yes.
and they released him.
Yes.
You recall in his interview when he talked to the police about it as well, about the crash, having a car crash.
Yes.
And he told them he spent a week in the hospital.
I don't recall. I'd have to go back and look at that part.
You recall if he indicated to them, well, he almost went through the windshield.
Yes.
Now, he denied to Wusthof, the medical officials there, that he's appearing for treatment, any psychiatric history or history of mental problems, correct?
Yes.
Now, he told you his head hit the windshield, right?
Yes.
And he told, at the time of appearing for treatment 2 days after, it was simply the airbag.
Yes.
He told you he wasn't seat belted.
Yes.
He told hospital officials that he was seat belted.
Yes.
Did your testing pick up this discrepancy or the differences? Your testing for malingering picked up that he was telling you an exaggeration or greater differences than what he reported for medical treatment?
That is, malingering is one possible interpretation of the event. An alternative hypothesis would be is his inconsistency was related to not having adequate memories and stored. That's why I requested neurocognitive imaging to provide information about the presence of a head injury, that inconsistencies. Because when people do not or unable to form memories, they can tend to confabulate. That means provide details which aren't accurate, but it's not based upon malingering. It's not based upon trying to manipulate the outcome. It's based upon not having that information stored, and at an unconscious level, the brain provides information to complete that.
So he's not malingering, he's just, to you, giving you greater examples of his injury, not being restrained, and increasing the effect on him, but you don't find that he's not malingering or exaggerating to you?
I examined both possible hypotheses, and the data was more consistent with my opinion. You mentioned the SIRS. I did not administer that because in my training it has too many false positives, so they no longer recommend it according to the Forensic Board of Psychology. The other test, the TOM, is a fine instrument, but I administered other instruments which are equally fine. So I have confidence that he was not malingering or providing false information. He was providing information based upon his perception.
You would agree that the information he gave you is certainly, if not a lie, an exaggeration of what he reported to the hospital 2 days after the crash.
I would interpret it inconsistent.
And it inconsistently in that it increased his symptoms and the damage that he suffered, correct?
It was mine, he reported to me, was more impactful than what he reported to the hospital.
Hospital, he said, I hit the airway. You, he said, I hit the windshield.
Correct.
Do you see that as he's increasing what happened to him in the crash?
Yes.
Hospital, he said, I'm wearing my seatbelt. You, he said, I'm not wearing the seatbelt. You see that again, he's increasing.
Yes, that's a possibility. Yes.
Not a possibility. Isn't he increasing?
It is an increase in the severity of the injury.
And it's not backed up by the medical records, what he's telling you.
No.
Yet you don't see that as malingering.
No. He reported that when those events happened, he was involved, he had drugs in his system, and it was more consistent with having an impaired ability to store information and confabulation versus cognitive malicious attempt to malinger.
This is a crash he didn't see the need to seek medical treatment until 2 days after the crash.
when he described that when he was coming off his drugs, he started feeling the pain. They wanted to take him at the scene, but he refused. He did not have insurance, and he refused to go.
Let's go to the psychological history. You talked a little bit about the defendant claims starting at the age of 12 or 13. That's when he indicated at that age is when he first heard voices.
Correct.
But he didn't report that. That was never reported to anybody. The first documentation of him reporting it is in September 2012 in the jail facility, correct?
Correct.
And you reviewed the school records.
Yes.
There's no note of referral in there?
No, I wouldn't expect to see it, but no, they were not.
You wouldn't expect to see even any comments?
Absolutely no. They don't keep that documentation.
So how many school records have you reviewed?
Hundreds.
And you've never seen a school record where, I'd accept that they're not going to have the psychological examination there, but no note of referral, no comments that this was observed?
Never in the standardized means that they complete the record keeping for school systems, no.
So you've never seen it in any record you've ever received from a school system, any comment from a teacher that she observed this unusual behavior?
Not in a standardized means that they collect and maintain school records today, no. They did not have it. Now, if I went to an individual school, a guidance counselor might have some notations of that. But again, that's not part of the responsibility of a school system. In fact, those diagnoses or medical diagnoses, we are not allowed as school employees to provide medical diagnoses.
Not talking about the psychological exam, but comments and that are contained within school records, correct?
I've never seen any. I would suspect that maybe a guidance counselor might have in her own personal notes some mention of that, if that happened within the school, but I've never seen them in a standardized way that's maintained on a standardized transcript.
In your years of practice and your evaluations that have been done, and all the school records that have been provided to you, you have never seen in those records anything such as a comment from a teacher or anybody else concerning unusual behavior?
In the school psychological records, for example, if a child is being diagnosed of
So you
having...
have seen that in school records?
Your Honor, I object. Unless witnesses allowed to finish answering the question.
It was a yes or no. Has she ever seen it?
Okay, if for purposes of that question, if you'd answer yes or no.
Okay, in a standardized transcript, no.
Have you seen it?
I have seen comments in special education records regarding concerns about emotional behavior functioning. If you're talking about emotional problems in special education records, yes, but not in a standardized transcript from a school setting.
Now, you indicated when the defendant went to Rustov, and that was February 3rd, 2008.
Yes.
He denied with them having any psychiatric history or any mental health concerns.
Yes.
And you would accept that's something that when somebody comes in, one of the issues that the hospital is going to look at, right?
The screen, yes.
Yes. And there's no indication from the records that they observed any concern?
No.
And he denied any history?
Correct.
And when he went to the Department of Corrections, their screening was also done?
Correct.
And the screening did not produce any indication or concern of any mental health issue?
Correct.
And he denied having any history of any psychiatric problem or mental health concerns, correct?
Correct.
And when he was arrested on this case, using the jail records from March 7th, 2012, they did a screening of him coming into the jail, correct?
Correct.
And he denied to the jail having any history of mental health problems.
Correct.
He denied any history of mental health treatment.
Correct.
Denied any family psychiatric history.
Correct.
Denied any head injury history.
It was in the DOC reports. And there was some inconsistency at times. Initially, he did not report it, but later on in the records, it was documented.
Did he did the jail records when they brought him in on March 7th indicate he was lucid,
I believe so, yes.
coherent,
Yes.
did not display any symptoms of mental health problems?
No, not there.
They did not. That's correct. That's what they indicated. He did not display any symptoms of mental health problems.
Correct.
And then he was transferred to the John E. Polk Correctional Facility,
Yes.
and they did the admission of him in March 2012 as well, correct?
Correct.
And he denied with them any history of psychiatric problem or mental health concern.
Correct.
And they also did a mental status exam on him, March
Correct.
13th,
Correct.
2012, right?
Correct.
And that was found to be unremarkable.
Correct.
The first time, concerning his report of hearing voices, the first time that is ever any documented history of him complaining about this was not until September 11th, 2012, correct?
Yes. That's consistent with my notes.
Now, concerning the Miranda test that you gave, you used the term knowingly, voluntarily, and freely, right?
And I'm sorry, I didn't hear that.
Freely? What terms do you use concerning, what are you looking at for a person's waiver of Miranda?
Intelligently, knowingly, and voluntarily.
Okay. Let's look at knowingly. How do you define knowingly?
Does he have a sense of awareness of what he is doing?
Which would incorporate then a sense of awareness as to what those rates are,
Yes.
and that he might incriminate himself or possibly incriminate others, correct?
Yes.
And that's one of the factors you look at, is his awareness of incriminating himself or incriminating others.
Yes.
How about voluntary? How do you define that?
Freely, without any coercion.
Which would be threats,
Correct.
officers threatening him, physical threats, verbal threats, right?
All of the above.
Actual physical abuse from the officers.
Correct.
And intelligent, how would you define that?
Logical, with logic and reasoning.
And when you say with logic and reasoning, what do you mean by that?
Intelligence represents a person's ability to apply thinking skills in the decision-making process, and logically.
Do you use a different test than somebody just saying, well, it wouldn't be logical to confess to the police? That's not what you mean or imply by that, correct?
No.
So it's simply evaluating his situation and making a fair decision on whether he wants to speak to the police, right?
Yes.
Now, you talked about in these tests that you gave, the Grisso test, and then there also was the SAMA test concerning Miranda, correct?
Correct.
And the SAMA is the SAME, it's the Rogers Standardized Assessment of Miranda, I think if I
Abilities, yes.
validity test. SAMA for short.
Yes.
So if I use the term SAMA and Grisso, we understand which test we're talking
Correct.
And when you testified on direct concerning the percentile where he scored, you indicated in one portion of the test he scored in the 1 percentile or the 99th percentile?
It depends upon how the question is asked. In other words, his performance on the measure of acquiescence, in other words, how much did he demonstrate, how much did he show on this test, his performance was at the 99th percentile, so he demonstrated lots of acquiescence, which is, and so that means that this characteristic tendency of his was extremely high.
But the standard that you use in percentile is compared to other adult offenders, correct?
Yes, right. Other,
So it's not the general population.
correct. It's a population of people who are likely to experience having to give up or asked to give up the Miranda rights.
Adult offenders, people who've already been in the system.
Yes,
So you're measuring his willingness to give a statement versus other criminals.
that's right. You compare it to the norming population in which the test was normed on, standardized.
Comparing, but the population is other criminals,
Yes, in similar to...
not the typical average law-abiding person in the community.
Correct.
And this is acquiescence to law enforcement? Is that what you're measuring?
Just somebody in authority.
Which, obviously, for Miranda is only going to be
Right.
law enforcement, correct?
Correct.
There's going to be nobody else in authority who's going to give Miranda warnings and then an interrogation and police interview unless they're police officers, correct?
Correct.
So you're comparing his measure of acquiescence to authority versus other criminals.
Correct.
Now, on the SAMA test, we'll talk about that first. You indicated that there was a portion of it that he simply claimed no memory.
One of the subtests, yes.
And that's where he was scoring in the impaired range?
I didn't score it because he doesn't have any memory of it, so I couldn't measure it.
Okay. And then on the Grisso test, that's where you scored the acquiescence to authority, correct?
No, that was on the SAMA.
SAMA test, okay. The Grisso test has 4 sections, correct?
Correct.
Comprehension of Miranda rights, comprehension of Miranda rights, recognition of those rights, correct?
Correct.
Third section would be comprehension of Miranda vocabulary.
Correct.
The fourth section would be function or rights in interrogation.
Correct.
Okay. And function or rights in interrogation, what is meant by that?
It means, in this is measured by having a vignette, kind of a brief story, in which Mr. Bradley was asked about how the person might be feeling when they're being questioned by police. So it relates to a hypothetical setting in which officers are asking questions to an individual.
And in that particular section, in the function of rights interrogation, he was normal, right?
Right.
The normal range.
Right.
Comprehension of Miranda vocabulary, normal range.
Correct.
The comprehension of Miranda rights recognition,
Let me see. He had difficulties on that test.
but he did have, you indicated, an ability to repeat various statements.
Yes.
What do you mean by that?
It means that, what does this word mean? And he could define it. The ability to recognize that right in an example provided, he had difficulties doing that. So in other words, he could define the word, but when he had to apply it, he had difficulties in a hypothetical
So
situation.
he knew what the words meant.
Yes.
And his function of rights and interrogation was normal. So he knows what the words means, and his function is normal.
Yes.
Now, you indicated where he scored the worst, which you brought up on direct examination, was his acquiescence to authority.
Yes. Yes.
In other words, if somebody in authority
I'm fine.
Somebody in authority tells him to do something. Compared to other criminals, he's in the portion that is most likely going to obey that request, right?
In a standardized setting in which he is in touch with reality, the answer is yes.
You reviewed the video of the shooting, the murder of Deputy Pill, correct?
Yes.
You would agree that Deputy Pill is telling him to step out of the car.
Correct.
And she told him that numerous times.
Correct.
And he did not acquiesce to that person, Deputy Pill, in her request, did he?
He asked her if she was going to shoot him.
She made numerous requests for him to get out of that vehicle, right?
Correct.
Did he ever get out of the vehicle?
No.
Your Honor, may I have one moment?
Yes, you may.
Did I have no further questions?
Okay, redirect on behalf of the defense.
In reviewing the Woodstock records and the automobile accident in 2008, comparing that with the version reflected in the Woodstock records of how the accident occurred, with what Mr. Bradley told the police, with what he told you, is it clear in the Woodstock records who the reporter actually is? When you get that, you see in the records, which would be page 1, where, as you just indicated, the car T-boned another car. Patient relates hit face on airbag, cut the eyebrow, possible loss of consciousness per witnesses at the time of the accident. So is it clear here that that information is actually coming from Mr. Bradley?
No, it's not completely clear.
Okay, and at that time, he, according to the records there, he was reporting to the hospital this accident when he had cocaine and Xanax and marijuana in the system and was in pain and was there for treatment of the pain.
Correct.
Right, and so would the inconsistency be explained by those kinds of factors, which, I mean, as far as what's in the records, it's really not clear who the information is being gathered from.
That's correct.
And in the version that the recitation to the police in the DVD, where he said, when he was questioned by the police, I believe he said he went through the windshield and was almost killed and spent a week in the hospital. But he didn't tell you that part, did he?
No.
That he went through the windshield and was almost killed and spent a week in the hospital.
No.
So that would be a less severe version than what he actually told the police.
What he told me was less severe, absolutely.
Did you get an impression at any time when he's relating his history of his head injuries that he was confabulating or trying to fake bad or trying to increase the severity of what happened?
No, I did not get any indication of that.
And your face-to-face interview, is it or is it not helpful in that fashion, essential, actually, in your determination of whether what he's saying is at least his best effort to give you a truthful answer?
Absolutely. I mean, we communicate both with words, which are verbal, and body language, which is nonverbal. And there was no indication that he was attempting to embellish, exaggerate his experiences.
We talked about reasons why in these what what you would call a screening setting at a jail or a prison, or hospital for that matter, where medical treatment is being sought. Reasons why an individual in communicating with whoever the screener is would not acknowledge mental health issues, talking about that. And do you know, are you aware of the qualifications of the individuals in these settings to gather that type of information? And to obtain an accurate picture of the person's mental health history?
I reviewed many jail records, medical jail records, and it's not uncommon to find people report normal mental status exam for people to deny having mental illness, and a few months later they're sent off to the state hospital.
Do you know how, in what depth and for what length of time the interviewer in a jail setting or a prison setting gathering that information actually spends gathering that information?
I don't have any specific.
Do you know what terms are used? In other words, how the question is put to the interviewee, Mr. Bradley in this case, as to the mental health history?
The form that they use, that the records are documented, is just a simple statement: have you ever received treatment? That's what I commonly find, which is yes, no, yes, no, yes, no answers.
Okay, and there's a whole lot of questions on those formats, are there not?
Correct.
And is there a full section with in-depth questioning about mental health history?
I don't see much of that at all.
Did you see the specific documents that were generated by the jail, like the Department of Correction, as to the questions that were asked, read?
Yes, and they were just basic forms that's commonly used, just simple.
What kind of questions were asked?
Have you ever been treated for, or have a history of psychiatric hospitalizations? Have you ever received treatment for mental health issues?
The fact that a person has never been treated or hospitalized, does that mean that mental health issues don't exist?
No, it doesn't mean they don't exist.
Is it also is there a cultural component to answering questions in the negative about mental health problems?
Yes, and I also find that people who tend to come from low socioeconomic settings are more often deny because of the sense of stigma attached to it.
Is there an educational component as well in the way a person would answer questions about mental health history?
Absolutely, because they're more likely to have insurance so they could seek services.
And what would be the level of sophistication of somebody with, let's say, a high school education readily about mental health issues?
It varies depending upon the family. If the family has insurance, if the family is educated, if the high school diploma is just a stepping stone onto higher education, they're more likely you're more likely to be able to find supportive documentation.
Now, when you're talking, now we're moving to Miranda. We're talking about the knowing, intelligent, voluntariness aspect and focusing on voluntariness. How would you relate what you learned of Mr. Bradley's history of abuse with the voluntariness component of the giving of the statement, waiving of Miranda?
Mr. Bradley is a passive dependent individual who came from a dysfunctional family, abusive, and he's somebody who...
By stepmothers.
Yes, and rejected, mother non-supportive. This is a person who turns to others by support because of his organically based personality, the way his personality exists. People are born with a dependent or independent personality. Okay, both types can be healthy, both types can be unhealthy. The basic difference is a dependent person prefers to have other people meet their needs. An independent person prefers to meet the needs themselves. Dependent people who are healthy tend to be the popular kids in school because they develop social skills, they develop the ability to connect with others. So that's a healthy one. However, a dependent person who's raised in a dysfunctional home, and I saw that all the time when I was in the school system, is much more vulnerable to have negative outcomes because the primary source to go to does not provide it.
During the interview, the portion where the police or agents are talking with Miranda, there is a moment when the police walk into the interview room and they, quote, help him off the floor and into the chair. Do you recall that and observing that?
I watched that component on multiple occasions.
Why did you do that?
Because I wanted to make sure that I had the opportunity to carefully evaluate his presentation at the time he waived his Miranda rights.
But the component where he's put in the chair and how the way he's put in the chair and how he reacts and how that relates to the voluntariness.
He is literally picked up and placed on the chair, and as he was slowly aroused, there was his nonverbal sign was one of fear.
And would you describe him actually just sitting in the chair, or that pure force was used as it relates to the issue of voluntariness?
He did not voluntarily get on the chair by himself. He was literally picked up off the floor and placed on the chair.
Now, when asked about the cooperation of the head injuries, when you asked for cooperation what was more important to you, or what was important to you in determining the validity of the history of head injuries? There are a couple of components. One is the internal consistency, would you say, of the versions had?
Yes.
And how about the cooperation through the neural imaging?
Yeah.
What would be of greater importance?
When I formulate an opinion, I take into account the person who's in front of me, who I observed over a period of time. I take into account my test results, including validity and reliability. And in this situation, I had the opportunity to have the neuroimaging. So based upon the consistency, which is really important, of the objective data, as well as his reported statement, it was a very clean, in the sense that they all were very consistent.
Is there a term for that?
Okay.
Goodness of fit?
Okay, what I was going to say was, when you do these evaluations, when you utilize a scientific method, you come up with various alternative hypotheses as possible findings. And you use what is called a goodness of fit model. In other words, by putting all the data together, does it support this hypothesis or this hypothesis or this? Okay, so it's kind of a goodness of fit. What fits the data best? And in Mr. Bradley's case, the data best fit the presence of a head injury associated with a lack of a disruption in the control processes, a disruption in his processing speed, a disruption in his self-awareness, all related to that executive prefrontal lobe.
And a disruption in his ability to process information, what he observes?
Absolutely.
Would you say, what was more important? Let me ask this. Was it important for you to determine whether the automobile accident in 2008 was the source of the head injury?
The most important thing was the presence of a head injury.
And you determined that through your neuropsychological testing as confirmed by the MRI and the PET scan?
Correct.
As it relates to the date you've been asked to testify about, which is March the 6th of 2012.
Correct.
So for your purposes, in coming to a conclusion that there was a head injury, that the automobile accident was, or others of the incidents, was the source of that head injury, and that at the time when Miranda was waived and the statement given, it had an effect on Mr. Bradley. Were you satisfied in your review of all the information that that was the case?
Yes, and particularly the results of the neurocognitive imaging found abnormality that is consistently found with people who have a traumatic brain injury and people who suffer from schizophrenia.
What is the age of the onset of schizophrenia?
You can have childhood schizophrenia. You can also have schizophrenia at any point in life if you've had a head injury. There's actual cases where a baby is born and it experiences a hypoxic event or a lack of oxygen, and then 20 years later they develop paranoid schizophrenia and no family history of it. So brain injury can exacerbate or cause the development of a psychotic disorder.
If in taking you told Mr. Bradley that you were there to evaluate the Miranda issue, or how did you put that to Mr. Bradley?
Well, the second one I explained, look at his competencies and as it pertains to the Miranda rights.
And would you expect if there were malingering, well, first that would show up on the Paul House test, right?
Yes.
And wouldn't you expect just zeros, goose eggs all the way across the board in the standard Miranda test you gave him if he was truly trying to fail it?
Yes, I wouldn't expect him to come up in the normal range on a lot of these tests.
And he did.
Yes, absolutely.
Some, but not all.
And again, it was consistent with my test to determine whether or not he was providing information based upon his perceptions.
Now, you indicated that acquiescence is most likely to acquiesce in a standard setting if in touch with reality.
Yes.
At the time 8 hours earlier of the shooting, did you have any indication that Mr. Bradley was not in touch with reality as it relates to your finding of voluntariness?
He was suffering.
Okay, let's have a bench conference.
the time where you're focusing here is 8 hours after, 7 to 8 hours after the shooting, correct?
At the Miranda, yes.
Correct. And that's after Bradley, as you observed, was either sleeping or passed out
Correct.
that entire time. And you indicated that he did not acquiesce because for a number of reasons, in your opinion. And you indicated that a person, in order to acquiesce, has to be in touch with reality.
Yes, and in regards to being in a cage-like setting where the only possibility would be to sort of like in the Stockholm Syndrome when somebody is kidnapped, and it's a coping mechanism for survival is to go along, to follow the commands.
Is there a drug influence in the voluntariness?
Oh, absolutely, because a common symptom with the ingestion of drugs is sluggishness, a lack of awareness, drowsiness.
So the greater the impairment, the less likely a person is to voluntarily give a statement.
And knowingly, I mean, he was asked a question and he responded in an accurate manner.
And so for that 8-hour period of time, given what you know about his history and the drugs in the system, then would his ability to acquiesce be greater or less 8 hours earlier? Revisiting what the state went into on cross-examination.
Okay, based on the ruling I just gave, I'll sustain the objection.
Did it appear over that 8-hour period of time preceding the interrogation of Mr. Bradley was that the drugs in his system were wearing off? Did you get that impression from what you observed 8 hours earlier while he was sleeping and falling out of the chair, as you put it, until the police officers walked into the room, that the drug effects were decreasing?
So 7 or 8 hours earlier.
When you first started watching the DVD,
Okay.
until the time the police walked into the interrogation room, did you get an impression of the drug component as it relates to voluntariness, whether he was coming down or going up in terms of being high?
He appeared impaired in both situations. I would defer to the drug expert on answering that particular question.
And we're talking about this acquiescence standard is people who are adult offenders who are more likely to know their rights. Would that be correct? Is that a correct assessment from your point of view as somebody with experience dealing with the SAMA and the Grisso tests?
Yes.
Compared, since the basis of comparison is other adult offenders, would you say categorically that adult offenders are more likely to, or less likely to acquiesce because they know their rights and they've been through the system?
That would be a logical assumption.
I mean, is that
Yes, that's my opinion.
what you know through your experience and training
Yes.
about the background,
Yes.
the validity of these tests?
Yes.
You indicated that on the SAMA, the Miranda test, Bradley was able to recognize his rights, but he had difficulty applying them.
Correct.
And how does that apply to the voluntariness of the statement and the waiver?
It means that, again, when he's not, it's somewhat like apples and oranges, because when I evaluated him, he was coherent, logical. But what I observed on the tape was not a coherent individual. So,
At what point?
well, throughout the whole period that I watched and viewed on that whole interrogation tape, this was a man who was confused. He had problems with his coordination. He could not control his emotions. This man was impaired throughout that whole...
About his ability to speak as it relates to...
He mumbled. I had a very difficult time speaking to him. He required frequent repetitions, and it was often as if he would say a few words, and then the officer would say, okay, this is what you mean. And he would mumble, yes. It was almost like they were kind of helping him complete his statements by reformulating, is this what you meant, or is this what you were saying? So he basically directed and guided his response. And again, when they asked him questions like, how long have you been in a relationship, I'm paraphrasing, how long have you been in a relationship with this woman, he mumbled something about age 12. Well, he actually met her. He hasn't been in a relationship with her since the age of 12.
What was Mr. Bradley's demeanor like, his ability to communicate on the first meeting with him? What kind of correction was it?
He was, his presentation overall was consistent with somebody who was experiencing psychotic events, psychotic experiences. He was fearful, he was paranoid.
How did that compare to what you observed in the DVD of his demeanor, his ability to communicate?
He was better than what was, he was, when I saw him first, he was better able to communicate. He wasn't as impaired compared to his presentation on those DVDs. He was very impaired.
And then the final time that you met with Mr. Bradley at the Fulton County Correctional Institute, was that, did I understand you correctly, that was at the point in time when he had begun to take the psychotropic medication?
Yes, he was.
What was his demeanor like on that occasion compared to the interview with the police and your first interview with him?
He was significantly different. I didn't see the elements, the characteristics, or symptoms of paranoia. His mental status was much more stable.
Did you see signs of responding to internal stimuli?
Not the second time, the first time, yes.
What does that mean, responding to internal stimuli?
You could tell he was distracted. He was responding to information, not from me, and nothing that I observed in that setting.
No further questions.
Okay, recross by the state.
No, Your Honor.
Okay, ma'am, thank you for your testimony. You're free to step down.
And thank you, sir. Okay, I'll finish.
Okay, we're going to go ahead and take the lunch break. If you could get back here at 1:15, we'll be at lunch until 1:15. Report to the jury assembly room at 1:15. During this lunch, you must continue to abide by your rules governing your service as a juror. Specifically, do not discuss this case among yourselves or with anyone else, or allow anyone to discuss it in your presence. Do not speak to the lawyers or the parties or the witnesses about anything. You must avoid reading newspaper headlines and/or articles relating to this trial or its participants. Avoid seeing or hearing television, radio, or internet comments about this trial, and do not conduct any research yourself regarding any matters concerning this case. Okay, court will be in recess until 1:15. Thank you.
All right.
Okay, please be seated. Any matters that we need to address before we recess for lunch as well? Okay, court will be in recess until 1:15. Thank you.